So good morning, everybody. Welcome to September and to your first DCCA of what Children's Services thinks of, and I'm sure all of you do too, as sort of the new year. I've been saying all month that September is New Year's for childcare. For everybody else, it's January, but for us, it definitely is September where we get going again and things are new and new programs are starting, et cetera, et cetera, et cetera. So thank you for coming to the West DCCA. There's a lot of us here today. We have quite a full agenda. We have a number of presentations this morning. So I wanted to thank you for coming and taking time out of your day to do this, as well as I wanted to make sure that all of you know that this is our first foray into WebEx, so we are actually live streaming this, and if you're listening to me from a computer, if you could please mute your computer microphone, that would help. And welcome to all of those who are not here who have also joined us as well. That's what that e-blast that you got last week was about. So it does give you the option that if you're not able to attend in person, that you can sign in through WebEx from your home office or from your center. I wanted to introduce some folks this morning, and first and foremost want to introduce the new district director for the West District. She's not new to the city, but she's new to this position. So Teresa Masso is the new West District director. As you know, we've gone through a transition in terms of staffing with our district operations team, and Teresa joined us in June. She's had a long history with the City of Toronto, all in human services, including 311, including Children's Services for a time in 2012 when we were working with the funding model, which you know is the rollout of the General Operating Grant, and also has spent a considerable amount of time in Parks, Forestry, and Recreation. So please introduce yourself to her today so that she can put some faces to names. She's been out and doing some visiting and meeting community and at community events, but please do introduce yourself today to her. D-A-M-A-S-O. I'm visual, and I'm thinking, where's my pen? I have to write it while I spell it. A spelling bee I could never do. We have a number of city staff here today, including consultants, budget coordinators, funding model staff. Nancy Hendy is here with us today as the Every Child Belongs model lead. She's doing an item on here with us. We have the provinces here. Jarina, I lost her. Where is she? Thank you. Jarina is here as well. Karen Guthrie is here as our centralized consultant taking minutes. So if there's something that we move past too fast, she may ask you to slow it down a little bit so she can catch it. And then across the top, we have Cindy McCarthy, our co-chair, and Janet Burchard, and Suzanne Field and Dina Warman, and of course our techie specialist, which is David Joseph. So the agenda review, I think it's up behind me here. We'll do a Children's Services update. Nancy will review the Every Child Belongs model service request system. We'll chat quickly about the Children's Services revised serious occurrence reporting. Jarina we'll talk about the Ministry of Ed serious occurrence procedure changes, and then we'll spend the latter part of the evening reporting back to you on the District Child Care Advisory review that we're in the process of going through, and your co-chairs and folks will review all of that with you. Please ask questions as we go through, and with that, I'll turn it over to Therese so that she can start your Children's Services update.
Great, thanks. It's so nice to meet everyone. Please make sure you introduce yourself at the end so I can get used to who everyone is. I will be making visits, so hopefully by the end of this year I'll be out to many of the sites. Just on the announcements piece, everyone heard about the last two provincial announcements. There's the creation of another 100,000 licensed spaces, and that's across the province. That's not specifically to Toronto. We don't have any information, but we are looking forward to actually finding out some more information, but that was the one recent announcement. And then the other announcement, as everyone knows, that as of September 1st, 2016, there will no longer be fees for waitlists. So that's another piece that was announced as part of the recent announcements. As far as the budget, I just wanted to let you know, many of you have heard that there's a 2.6% reduction that every city service has to come up with. We will be going live with the budget launch December 2nd. So once the budget goes live, you'll be able to get a copy of the Children's Services budget online. None of the budgets go live before that date. There'll be budget briefings and program reviews. Those are December 16, 19, 20, and 21st. There'll be public presentations for budget committee. So if you watch January 4th, 5th, and 9th, you'll be able to actually see the public piece on the budget. Budget will actually wrap up at a special council meeting on February 15th and 16th. So up until the 15th and 16th, there can be changes to the budget at that council meeting. It can actually change right up until then. In regards to Community Development and Recreation Committee, we actually have a report that's going in September, and that's Planning for the Ontario Early Years Child and Family Centres. There's 4 recommendations in this report. The first recommendation is that City Council requests the Province of Ontario to recognize and fund the costs associated with planning and transformation of ongoing system service management. The second one is around accepting funds from the province, and that's to support 2 full data positions. So that's the second recommendation. The third recommendation is around establishing 3 permanent positions. All of them are 100% city funded, and that will be in the 2017 budget process, and one of them being for French language. The last recommendation is around the funding formula and including allocation of provincial resources to be provided to Toronto on the financial impact of the city's transformation, sustainment and delivery of the child and family programs when the funding formula and allocation becomes available in early 2017. We will have a quick update today on the funding formula. The other piece is in October, we will actually be having the home child care study going forward. And there's a recommended change, and we're looking to seek authority around the funding approach for home child care from a daily administrative rate to based funded approach. So this will be new, and we are seeking approval on that. We're also requesting approval around zoning bylaw update to allow for up to 6 children per provider. So that's new, and we're waiting for approval on that in October. The other piece is around a demand study. You may have actually been aware that the city went out for an RFP for consultants. And there's a research team that's led by Dr. Gordon Cleveland at U of T, and it was to conduct a new demand study around affordability. And the study is almost near completion, and that will be at the October CRDC meeting. So I just want to give you a quick update in regards to the, have you been going through? Okay, perfect. So just around, sorry, I've lost my space with these. The launch of the 2017 budget, it's going to be online and available October 17th. Child care centers budgets are due November 25th, so please make sure that you keep track of that timeline. So in preparation for the 2017 budget year, we encourage you, there are going to be changes. We will be doing some updates. Please come to the sessions that we're running. We'll be looking at the important changes in the 2017 online budget application, changes to the funding model, and the new budget guidelines. So please make sure, because someone from the funding model team will be there to do the updates. Online registration for the budget overview session is now available. So go online and you can actually register for the session. All right, so the dates are up there for the overview session. So we're encouraging you to please, there's one in each of the districts. So if you can actually, if you want to take them down, it'll also be an e-blast that will actually have the dates available for you. Okay, so funding model. Just really quickly, the funding model team is visiting operators that have known changes. So you may have already had a visit from one of the consultants. The team will be sharing information relating to the management of the general operating grant. We're also updating service contracts. So please try to make sure that you have a schedule, that your November Board of Directors meeting, that you actually review it as of January 17th, you actually have to submit a signed change contract to Children's Services. So try and plan that in your actual meeting. January 1st. Okay. All right. And then just as far as placement, I'm sure you've been getting a lot of questions around placement. There are a number of clients who have submitted appeals. We are actually working on a strategy to accelerate this response to them. So that's in process right now. We have a larger number of appeals than we've ever had before. We're looking at placing in underserved wards at this point in time only. And September, as you know, is a transitional month with a number of new program admissions and flips. We're hoping that by October we'll have some stabilization, and in the first week we'll be looking at the directive again in October once those flips have taken place. Okay. And so the next one, so I'm going to introduce Nancy Hendry, and she's going to be doing an update on Every Child Belongs and the changes. Yeah, absolutely. There are in underserved wards. I don't have that number in front of me right now. But the best thing to, so if you get in contact with your caseworker, and they'll be able to tell you which wards are being placed because they have all of that information, and they'll be able to give you the details on all of those placements. Anyone who's not being placed and they have an appeal, we're actually looking at that strategy to see how we can move them through the system faster so they're not waiting and they get answers right away. We are placing though. We are placing infants. So yes, that's correct. We do have that number. I don't have it right now. I think Faye's going to look that up. We do have it. It's posted online. We have it for each of the areas. Faye's going to look it up right now. Yeah, we'll get that information and then I can update at the end for sure. Yep. Sure, absolutely. Yep. It's hard because it's tough because the screen's behind me and I'm trying to track what they're doing behind me, so I apologize. Yep. And the other piece is this will all be online because we are streaming it today, so you'll be able to go on and get the dates and everything from the online presentation. Yep. Okay. So is this not working? Because they have this, the mic is for the streaming, but it's tough because it's, okay. Oh, okay, okay.
If I can just add a comment to Jane's comment around
I don't have that.
I just wanted to comment that the vacancies across the city are really being hard hit right now because of the lack of placement in the custody system.
Yeah.
So I think if we can just have that recorded in the minutes, that it is creating a major challenge for many programs. Typical, we see this in the month of September, but typically towards the end of September, we're starting to see that rectify itself a bit, and now we're understanding that that may not be happening for some time. So it is going to create some real challenges in budgeting for this year, given that there are such a large number of vacancies.
So just in terms of language there, we are continuing to place. We're placing for shelters. We're placing OW. we're placing for, I think we slowed down on the siblings, but in wards according to our service plan related to the age and geographic, where the ward is underserved, we are still placing. In infant vacancies, there's 235 vacancies, and placed currently, I have to add them together. The total placed infants is 2,038. Total placed toddlers, 3,704. Total placed preschoolers, 5,414. Kindergarten, 5,774. School age, 8,499. So I'm just going to hold you there just for a second, Jane. That's physical capacity. This is about funded vacancies. So physical capacity is different. And when we were talking about that, that's our need to grow those infant toddler physical and build. That was related to the capital and related to the fact that we are growing the system with infants and toddlers in terms of building physical spaces. Mm-hmm. Mm-hmm. So we've reached our capacity right now in terms of our funded spaces. Yes, but we are still continuing to place. So you're right about the 5,000. You know, it can be as high as 5,000 or a little bit more that leave at this time of year. And we go through at the beginning of the meeting when I talked about this is really like the New Year's for childcare, where so much changes and it has to normalize again. So we'll watch what's happening with the funding envelope to be able to keep placing, and we recognize that impact on operators who have those spaces for sure. All of those children, as they grow up, they've moved, as you can see from my numbers there, into the older age groups. We need to look at and continue to look at all the time that funding envelope and where we can open it according to our council-approved plan related to age and geographic equity, which, as you know, is the infants and toddlers.
Are there any other questions before we move on to Nancy? Okay. So, you want to come up?
Yep, I'm here. Hello, everyone. If you can't hear me in behind the pillars, just let me know, wave or something, and I'll speak louder. I had all of my background in drama, so I'm able to project well. Today, I'd like to introduce the Every Child Belongs Special Needs Resource Service Request System. So we're making requests for special needs resource service quick and easy through the online operators service system. You'll be able to make a request for an individual child-related consultation, a program consultation, or make a request for training that's related to special needs resource service directly to your assigned special needs resource service provider through the Special Needs tab in the online system. I'm going to tell you a little bit about how it works, and then we're going to show you a brief demonstration video. And I know this is all going to be like a little bit of small amount of information, but that's okay, because starting on October 3rd, you'll be able to go in and look at the video online yourself, and you'll be able to get the user guide yourself. So we're on to slide 2, and here's how it works. So the child care supervisor, or the home child care home visitor, or really the person who would typically make a referral for special needs resourcing, will log into the online service system. They'll select the Special Needs tab and follow the prompts to input the service request information. When the request is for an individual child, you will have to have a signed consent from the parent or legal guardian before you make the request. The request will generate, so you put in the information, and then the request generates an ID number based on the information. When you press submit, the system sends an email to the SNR assigned to your program with the request ID number and the contact information for you, basically the person who inputted the information, in that email. It's important to know that no personal information is sent about a child or recorded in the system. That request ID number is what is used to match the requests between the supervisor and the SNR. So once the SNR gets the email, they pick up the phone, they call you, and they say, I see that you sent me a request. It's request number such and such. Can you tell me a bit more? Can you give me more information about this child, about the program consultation, or about the training consultation you're looking for? So that's basically it. It's really quick and simple. It only takes a few minutes, and that's one of the benefits about it, is that it is actually that easy to use. It also makes it really equitable because it doesn't matter which program you are, where you are situated, you can use this system. You don't have to see your SNR in person. You can just send it and they'll receive the request. It also makes it easy for you to find your SNR. You don't have to go looking in the system to see who it is. It automatically routes to that person. And it also provides a consistent practice across all the service requests, because now you're going to understand what exactly the services are. That information is in the online system as well. So next. So, oh, we missed a slide. That was the benefits. And then the next slide tells us about the timeline. So our objective is actually to have everyone using the system by January 1st of 2017. And we've developed this training. We're going around with the training. We have the training materials, as I mentioned before, that will be online as of October 3rd. And that includes the demonstration video and the user guide, and a sample consent form. And so if you're not currently using your own consent form, it'll be a good practice for you to get your own consent form up and using it. It's an important part of this is actually the ability for all child care supervisors to have access through the portal to make the service request. So we'll be supporting the assignment of user IDs and passwords through the process that's outlined in your Q&A, so in the question and answer that you received today in the handout. It's important to know that we can restrict access within the portal to only the Special Needs Service Request tab. So for those who don't need the other tabs, such as the financial tabs, they won't be able to see those other tabs. Those users will only be able to see the Special Needs tab. Of course, the Special Needs Resource staff themselves are very important to this, and we've given them training and support so they already know about the system and how to use it. And they're going to be coming out. They're going to be making visits to your centers to help you to understand and use the system. And when you ask them to do for a referral for special needs, they're going to sit down with you and that first time and say, let's put this through the system and get you using it. And so over the next little while, you'll be able to connect with your SNR about that. After October 3rd, the system will be up and ready for you to use. We're going to go right to the brief demonstration video now, unless there's any questions before then. I think it's pretty straightforward and actually a good news thing.
The Special Needs Service Request System. This video covers how to request an individual consultation. The system also allows you to submit requests for a program consultation or a training consultation. The Special Needs Service Request System is part of Toronto Children's Services Operator's Online Services System. You need a user account to log into the online services system and submit a request. Refer to the Special Needs Service Request System User Guide on our website for details such as how your user account is set up. Once you are on the login screen for online services, enter your user ID and password, and then click Login. Once you log in, you'll see the homepage of the system. You may see one or more menu options at the top of the screen. Click on Special Needs Services and select Request Services. First, select a service. The 3 types of services that you can request will be displayed. If you have questions about these services, please contact the Special Needs Resource staff who supports your childcare program, or email ecbsupport@toronto.ca. To fill in an individual consultation request, click on the Request button under the Individual Consultation heading. You will be asked to confirm if you have all the necessary information to fill in the request. When you are ready, click the checkbox to confirm and click the Start Request button to begin. There is a visual guide at the top of each screen that shows you where you are in the process. The current screen is Contact Information. If your user account is associated with one childcare program, the location information is already filled in for you. However, if there are more than one childcare programs linked to your account, you will be asked to select the service location from a drop-down list. If you do not see the desired location in the list, contact the person who set up your user account. If you are making a service request for a home childcare program, you will also be asked to specify the major intersection of the location where the service will take place. Below the location information is the contact information set up with your user account. If this is the contact information to be used for this request, click the Next button to proceed. However, if a different contact person or different phone number or email address is to be used for this request only, click the Edit Contact Information button to make changes. When you are finished, click the Next button. On this screen, you will be asked to provide the child's name, date of birth, and gender. Please make sure that you have obtained consent from the child's parent or guardian for submitting this request and allowing the referral to be sent to the Special Needs Resource staff. To protect privacy, the system will not save the child's name and full date of birth. The system will only save the child's age group, gender, and an anonymous reference number. On the screen, enter the child's given name and family name. You can click to see an example. Enter the child's formal name as shown on a legal document such as birth certificate or passport. Do not enter the nickname or initial. Then click on the calendar to enter the child's date of birth. Use the arrows to move forward or backward to the desired year and month. Then select the date. Select the child's gender from the drop-down list, and then click the Next button to proceed. If the Next button is not available, it means you have not filled in all of the required fields. On the Review and Submit screen, you can review the details of your request. If any of the information is incorrect, click the Back button at the bottom of the screen to go back and make corrections. Do not use the back arrow of your web browser, otherwise the details you have entered may be lost. You'll notice that the name of the Special Needs Resource staff who will receive this request is also shown on the screen. If everything is correct, click the Submit button. When the request is submitted successfully, a request ID will be assigned. If you need to cancel or change the request, contact the Special Needs Resource staff and provide this request ID. Now is the final step, to print a hard copy or save a PDF copy of the request details shown on the screen. Please keep this copy and share it with the Special Needs Resource staff, as the child's name and date of birth are only shown on the screen and the printed or PDF copy. They are only available to you. After you have printed or saved, go to the bottom of the screen and click the checkbox. Then click the Next button to continue. The process is now complete. From this screen, you can click the Create Another Request Request button to start another request or log out from the system. Here's a reminder about how to get help. Thanks for watching this video.
I just want to go back. One of the updates that I missed was around the special needs and the home child care and family support. So the budget's due November 25th. They will be available online in October. And I just want to highlight that we're not going to be mailing them out this year, so we're trying to save some trees. So that's one piece. The other is around the Early Learning and Transition Capital Funding and Child Care Stabilization Grant. Final submissions are going to be September 30th, 2016. And I want to stress that you're going to need to give notice to families who are receiving lunches, advising them that the funding will be eliminated effective January 7, 2017. So I just want to highlight these dates. For the stabilization grant, it's only available from September to December, and they have to, all of the final submissions have to be handed in to Metro Hall, 10th floor, by September 30th. So I just want to flag these two dates because they are important, okay? And then we're just going to go to serious occurrences. So just a couple of things. This one's actually a good news story. Okay, so for serious occurrence, we've revised our procedures in children's services effective October 1st, 2016. The good news is that operators will no longer have to enter in, to call the City of Toronto serious occurrence line for us to enter information into our system. It's going to be streamlined, so operators now, effective October 1st, only enter the information for serious occurrences into the province's serious occurrence information system. So you will be entering information into CCLS, so that's revised. This reduces duplication so that you don't have to report twice. That your consultant that you work with will be available as always to provide consultation and support if you need it. So you can still call our serious occurrence line. It will be renamed as a serious incident line, and the only difference is that our family support programs, our summer day, and our ARCs, the recreation, they will have to call the serious incident line if they have a serious occurrence. And those serious occurrence types are actually posted on the website, serious incidents, and that's for family support programs, ARCs, and summer days. They will have to call us. Every other operator will have to just enter it into the province's system. Any questions about this? They would be calling us on the serious incident line. So there's going to be an e-blast that's coming out this week with all the details, the serious occurrence types. Doreena's actually here today to talk about the revisions because as of August, they changed. So our serious incidents are aligned with the serious occurrences, but that's only for those programs that I mentioned. So everyone else, you just have to enter the information into CCLS. All of our consultants in children's services will receive a report and they'll follow up as required. So that's a change for all of the operators. You don't have to call the serious occurrence line anymore. It's available for you if you require consultation with your consultant, though. So we will still have our support available. Any questions? It's one good news story that we're reducing duplication. Yeah. No. Yeah. Mm-hmm. Sorry, there was a question Karen just actually clarified about OEYCs and whether or not they would have to report through Children's Services. And the answer was that they would continue their existing reporting through the province. So if there's no questions in regards to the serious occurrence, I'm just going to introduce Dorina, and she's going to provide a presentation on the changes that we've had, because as you know, we've actually reduced the number of serious occurrence types, and she's just going to provide an update on that.
Good morning. My name is Jarina Jukic. For those of you that don't know me, I'm a Senior Program Advisor with the Toronto Central team. I'm going to provide you with a brief overview about the changes that took place on August 29th. I'm hoping that we can save our questions until the end of the presentation, so just make a note if you have a question, and then we'll do Q&As right at the end. So one of the biggest changes to serious occurrence are the number of definitions and the definitions themselves. The new definitions of a serious occurrence are the death of a child who received child care at a home child care premises or child care center, whether it occurs on or off the premises. So an example would be a child develops a high fever at the child care center or at a home child care premise and is sent home or is picked up by their parent, and the child later passes away. That would be a reportable serious occurrence, even though the child's passing is not on premise, but there may be a correlation to the child's death and the fever that was developed at the center. B, abuse, neglect, or an allegation of abuse or neglect of a child while receiving child care at a home child care premises or a child care center. For example, a staff member observes another staff member forcefully grabbing a child. This would be a reportable allegation of abuse. Where there is an allegation that names a parent of a child, so a child comes into the center and discloses to a staff that their parent had hit them at home, this would not be a reportable serious occurrence. Where a child discloses that a custodian at the school forcefully grabbed their ear or pulled them by their hair, this would be a reportable SO. If there is a situation where a parent of another child is observed yelling or shouting or screaming at a child that is not their own at the center, that will be a reportable SO. A life-threatening injury to or a life-threatening illness of a child who receives child care at a home child care premises or a child care center. For example, a child is hit in the head with a baseball bat, has a concussion, and may lose consciousness. This would be reportable as an SO. An incident where a child who is receiving child care at a home child care premises or a child care center goes missing or is temporarily unsupervised. Example, during transition time, a child was left in the room unattended as the staff and children went outside. Another example would be, and this is not a reportable SO, and we just went through a slew of these at the beginning of September when school started. So where a child, for example, is being dismissed from school, has not arrived to the child care center, is not in the care of the child care center, they've been put on a bus and sent home in error, this would not be a reportable SO, as the child would not have been in your care at the time. Where a child is picked up at school by a parent or a caregiver for a doctor's appointment and doesn't show up at child care, or the staff go to pick the child up and no one seems to know what happened where the child was, of course you would continue to investigate. It is important that we determine what's happened with the child and that the child is safe. However, this would not be a reportable SO, as at the time the child was not in your care. An unplanned disruption of the normal operations of a home child care premises or child care center that poses a risk to the health, safety, or well-being of children receiving child care at the home child care premises or child care center. An example would be carbon monoxide detected and staff and children had to evacuate. One that in the past has been reported and would no longer be reported would be if the power went out at the center for a few hours, but there really wasn't a significant disruption in service. That would not be a reportable SO. If the hot water, you didn't have water for a couple of hours, however, there was drinking water available to children and there were other means of sanitizing hands, you didn't close the center, it will resume operation the following day, or you've dismissed children a couple of hours early, that would not be a reportable SO. So the disruption in service would really mean where there is a significant disruption in service where children are not, children and families don't have care. Okay, so in CCLS, we've had a few questions over the past couple of weeks about this. The categories in CCLS have now changed. There is the death of a child, 2, allegation of abuse and or neglect, 3, life-threatening injury or illness, and there are subcategories, A, injury, B, illness, missing or unsupervised children, A, child was found, B, child is still missing. So A, the child was found at the time that you are making the report. B, where a child is still missing at the time that the report is being submitted to the ministry, then you would select B. Unplanned disruption of normal operations, fire, flood, gas leak, detection of carbon monoxide, outbreak, lockdown, other emergency relocation, or temporary closure. And the one thing that you will notice is that the category of other is gone. So there is no such thing as other, and then you'd need to write in what the SO is. So we are really strictly reporting incidents that fall under the definitions as well as that fit into one of the categories or subcategories in the system. As far as your policies and procedures, every licensee shall ensure that there are written policies and procedures with respect to serious occurrences in each child care center operated by the licensee and each premises where it oversees the provision of home child care that address at a minimum how to identify, respond to, and report a serious occurrence. B, a report is provided to a program advisor of any serious occurrence in any child care center operated by the licensee or any premises where it oversees the provision of home child care within 24 hours of the licensee or supervisor becoming aware of the occurrence. And C, a summary of the report provided under Clause B and of any action taken as a result is posted for at least 10 business days in a conspicuous place at the child care center or home child care premises, and the report and the summary of the report are each kept in accordance with Section 82, which translate into a minimum of 3 years. Now, Section 38.2 states that every licensee of a child care center or home child care agency shall conduct an annual analysis of all serious occurrences that occurred in the previous year at each child care center operated by the licensee and at each premises where the licensee oversees the provision of home child care, and B, keep records of the actions taken in response to the analysis. And again, this is as per Section 82, which would be for a minimum of 3 years. Now, what do you need to know? The first one is when program advisors come out to conduct their annual inspections, or if they're coming out to follow up on a serious occurrence, they will be reviewing your serious occurrence policy to assess whether or not it meets compliance with the new requirements. So please do update your SO policies to reflect A, the definitions of the serious occurrence, B, how to respond to a serious occurrence, and C, how and when to report a serious occurrence. And we can go into a little more detail once I finish, if you have any questions about what that might look like. To complete the serious occurrence notification form, licensees are required to complete and post a summary of each serious occurrence in a place that is visible and accessible to parents within 24 hours of becoming aware of the occurrence for a minimum of 10 business days. The summary must not include any identifying information and shall be updated as new information is obtained. Where the summary is updated, it does need to remain posted for an additional 10 days as of the date of the update. If the serious occurrence happens on a Friday, the licensee is still required to report the serious occurrence within 24 hours of becoming aware of the occurrence. So that means if something happens on a Friday, you are at the center, you're aware that it's happened, the 24 hours would be Saturday. So the weekend is not, it is counted in the 24-hour period. And number 3, conduct an analysis of all serious occurrences that occurred in the previous calendar year and record any actions taken in response to the analysis. Now, sample templates were sent to all licensees in a memo that went out from our director, Holly Moran, on August the 29th. It is not a requirement for you to use that template. You can create your own, or you may already have a system that you use to track your SOs and to analyze the SOs that took place in the previous year. However, you can also use the template if you'd like. If you didn't get a template or you're not aware about when this came or who may have got it, you can email your program advisor and they should be able to provide you with one. Okay, questions? Go ahead. No, where it's a child falls and the question was if a child falls and breaks an arm. No, that would not be considered a life-threatening injury unless there is reason for you to believe and deem that this is a life-threatening injury. Then you would not be reporting it. Concussion would be. And the whole piece around, I know that in the past there was a requirement and everyone's understanding collectively has been where the child seeks medical attention. So a child falls and bumps their mouth and they've chipped a part of their tooth and parent has taken them to the dentist. In the past, we were reporting these as serious occurrences. That would no longer be considered a reportable serious occurrence. August the 29th, 2016. So it became effective at the end of August. It was posted as one of the proposed regulatory amendments, and that was yeah. Well, the details were available, and even if you look at the regulation right now, anything that any of the changes or any changes coming to us January 1st, 2017, September 1st, 2017, they would all be in gray. So I would encourage all of you to start looking at the regulatory requirements to make sure that any upcoming changes for January and September, that you're addressing those prior to the due date. Well, thank you for your feedback, and we do absolutely recognize the fact that there have been many changes and there are more changes coming. And we also recognize that we are not the only regulatory body as well. So there are many expectations from many sides for all of you, as there are for all of us and our colleagues at the city. We are all in this together. In a sense, we are co-learners. We are also here to support the licensees and the supervisors out in the sector. Feel free to use your program advisor as a resource. I am also available as well. Well, at this time, not as available as I typically should be because I'm carrying a caseload at the moment. However, and there are some of you familiar faces that do still tend to email me on occasion when you have a question, recognizing that I will be more available and accessible to you as I'm not out in the field inspecting. Mm-hmm. I'm not familiar with what the school's serious occurrence reporting procedures and requirements are like. They would certainly not be reporting that to us because ours is the Child Care Quality Assurance and Licensing branch. But I can find out. Mm-hmm. Right, and I can't speak to that. I'm not familiar at all with what their protocols are. Sure. Sure. Thank you, Jane. Any other questions? By the way that the requirement is worded, we have interpreted that, well, not we, the program advisors, of course, that comes from higher up. The interpretation is that it would have to be life-threatening. So if a doctor says, well, you know, there may be a concussion, monitor the child. In that situation, I would think it would be up to you to deem whether or not whatever the information that the parent has brought back to you is saying to you, I think this is a serious occurrence. And then you can report it. And as usual, the process hasn't changed, where the program advisor can then address that with you, have that conversation, and deem it as not an SO, or leave it as a serious occurrence. No, for reporting one that isn't, no, there isn't. It would be deemed as not a serious occurrence, as opposed to just be closed with a note that this is not an SO. Okay, so I will repeat. Okay, so I'll go back to the question before that, was where a child is taken to a doctor and the doctor says they may have a concussion, whether or not that is a reportable serious occurrence. And the answer was that in that situation, you would be the one responsible to deem whether or not the information you have would warrant a report or would require a report. And then the following question was, is there any penalty or any repercussion to the licensee for making a report which is not a serious occurrence? And the answer was no. Okay, so the question is, where a child has been signed out of the child care center and they're at school and there's an accident or an injury at school, the school brings the child back to the center, would the child care center then be required to report? And the answer is no, because whatever has taken place when they were signed out didn't take place while they were in your care. Any other questions? Wow. Oh, Karen. Go ahead. Right. So Karen's question is, where there is an outbreak, would that be an outbreak that's deemed an outbreak by Toronto Public Health? And the answer is yes. So it's not where there are a few children that perhaps are having difficulties not keeping food down through the day. It would be an actual outbreak that's deemed as such by Toronto Public Health. Absolutely. So Sandy's comment was that where a child is injured or falls ill at school, that there should be that conversation between the child care staff and the school staff, as well as with the parent. And I'll just add to that as well, this is why documentation is key, right? So even though the incident didn't take place at the child care, just making sure that you are documenting that so-and-so was brought back by the teacher or the principal or the school admin staff with a goose egg on their forehead. You know, they said it happened at morning recess in the schoolyard. So making sure that you're keeping that documentation. Rita? A life-threatening illness? Okay, so Rita's question is, what would be classified as a life-threatening illness? The things that come to mind for me, and this is not, this is not exclusive to the examples that I'm giving you. I'm thinking of things like anaphylactic shock, absolutely. Someone having an anaphylactic reaction at the center. Seizure. Food poisoning. Meningitis. I would say no. However, I will get back to all of you on that. Sorry, the question was where a child has an emergency plan because they do suffer from seizures, and a child has a seizure and the center administers the appropriate medication, and it's sort of a routine, would that be reportable as a serious occurrence? And my answer was, I think not. However, I will have to get back to you on that. Right, and this is why I would tend to think no, because it's part of the plan. However, where a child goes into anaphylactic shock, that would be different because clearly there was an allergen on the premise, which caused the anaphylactic reaction. Okay. So there aren't any other questions. I'll leave you with, just to let you know, because I do recognize some faces here from wards 1 and 2. I have wards 1 and 2 assigned to me right now in the interim. That position has been vacant. Wards 1 and 2 are part of our French language program advisors caseload. And right now they are in the process of filling that position, and I believe that a program advisor will be starting on October the 11th, at which time any of you that are currently assigned to me will be reassigned to this individual. Not right at October 11th, but soon afterwards. In case you're wondering, I know that I've had some emails that say, oh, hey, you're a new program advisor, welcome. So just so you know, this is just an interim measure, and it's to keep things moving and to provide you with a point of contact while the caseload is vacant. Okay, well, thank you very much, and I hope that was clear.
So Dina and Suzanne are going to lead you through the findings from the survey that you completed in the spring. She's going to lead you through, both of them will lead you through with the committee. So I'm going to turn it over to them. They're just going to set up now.
We're just trying to figure out the microphone because the presenters, there's a bunch of presenters for this item. But I want to say thank you to people who are texting in and asking questions. This is a test, and we're really happy to see how well it's being used, but it also makes us nervous. All right. Good morning, everyone. Can you hear me if I don't use the microphone? Can you hear me at the back? No. Okay. How is that? Better. Okay. Then I will sit down as well. So good morning. My name is Suzanne Field. I've got two microphones in my face right now. My name is Suzanne Field. I work for Children's Services. I'm a consultant, but I work a lot on policy and planning and various different projects. And myself and Gina from Children's Services were supporting the process that started earlier this year around looking at the DCCA as a process and developing the survey and inviting everyone to participate in that survey to really understand how the DCCA is currently working for everyone and how it can be strengthened. And so through this process, we've worked closely in the beginning. We're working closely with our co-chairs. So Jennifer in the West, and also Lisa and Ev and Gina, for those who know those operators in the other districts. So they were very much involved in the beginning in helping to create that survey and inform this process of how we were going to review the DCCAs. And then after we had those survey findings, we've been working closely with a number of operators as well, including Cindy and Janet here to review the survey. So what we want to do today, if you remember back in April, the survey was sent out, and many people, thank you very much, many people responded. And in May, in the DCCA meeting that we had, originally we were hoping to share the findings back with you at that point. But of course, that was when the regulations were also out, and that was a very, very important item to everyone. So we postponed the findings. But we didn't want to postpone responding to the findings. So for those of you who are in May, you may remember that we asked for volunteers to join what we call the DCCA strategy group. And that was a group of, how many of us? 10 maybe? That came together. And so through the summer, we've been meeting several times through the summer to review those findings, all of the information and input that you all shared. And talk about what those findings really meant and what we can do with those findings. So through those meetings together, we've developed a series of recommendations on the DCCAs moving forward, so how we can really strengthen the DCCAs. So what we want to do today is two things. So we want to share back with you those findings. So we're going to kind of share the highlights of the findings first so that you get a sense of what the surveys actually told us. There are a few additional findings that, like I said, it's a summary this morning, just in the interest of time, but we will share the full PowerPoint deck online, so you can see, and it'll be on the DCCA website, so if you want to go and look at some of the other findings, you can certainly go and do so. So we're going to share the findings to start, and then Janet and Cindy and Jennifer are going to share with you the recommendations that we provided, and we've got we definitely want your feedback on those recommendations. And in order to do that in a way that kind of makes sense for the size and the time, we're actually going to use some clicker technology. So I don't know if anyone's ever used clicker technology. We'll walk you through it. But basically, everyone will have things like remotes, and you'll be able to vote on the recommendations that we put up. So you'll be able to use that process to tell us whether you support the recommendations that we're putting forward. I do apologize. I think the people at home, there's not the opportunity to partake in the clicker, but if you have any opinions, you can certainly, do they have a process of, they can email us, yes. So you can send that information in through the email. Okay? Great, so to start, we're going to go through the survey findings. So again, just a reminder, because it was several months ago, and I know everyone's been incredibly busy with many, many different things, so not that I don't think the survey has been the #1 thing on your mind, but just in case. So as a reminder, we wanted to revisit the purpose of the DCCAs and consider how to strengthen their value for all stakeholders. And for those of you who were at the March DCCA meeting,
back in 2015, the process really started where there were small groups, some breakout small groups, and a little bit of a discussion about the DCCAs and how it was working for everyone. And at that point, there were a number of suggestions and opportunities for growth that really came up. And it really suggested that it was timely to look a little bit deeper into how we can strengthen it. So that's where the idea of doing a bit of a broader survey came out. And if you remember, the survey asked really about 4 key areas. So it asked about awareness, attendance, and accessibility of the meetings. It asked about the level of satisfaction and the comfort of everyone who was attending the meetings, and opportunities for engagement beyond the DCCA. So we really wanted to look at, if there weren't DCCA meetings, what other opportunities would you have available? And then preferences for future meetings. So what should we actually be talking about and doing at the meetings? How should they look? Okay, so it's important to know who actually participated. So when you look at the findings, you can see who they came from. We were very, very pleased with the number of people that responded. Usually in surveys, a good response rate is 33% of everyone that has the opportunity to participate participates. We had 44% of everyone, and the survey was sent out to all childcare operators and childcare providers. So there was over, I think in total there was actually over, I don't have the number in front of me, I apologize. I think it was over 1,000 people that it was sent out to, and that included all childcare operators, childcare providers, as well as children's services staff, the province, school board staff, and others that we know tend to attend meetings frequently as well. So you can see up on the board there, primarily most people who responded were childcare supervisors. We also had a great response from owners, directors, and board members. The 5% were other childcare professionals, so those were not supervisors. They may have been childcare workers within the centers or registered early childhood educators who were not supervisors. There was only 1% for the home childcare operators. So you see when we go through the findings, we didn't actually break it down to look specifically at home childcare operators because it was such a small number. So their findings were kind of grouped in with the others. And then 8% were not childcare operators. So that included children's services staff, the province, the school board, and others with invested interests. Okay. I'll just go through this next slide quickly, but again, just wanted to show who was responding. So there was approximately even representation of the districts. It was primarily external childcare operators, and what I mean by that, I didn't really know how else to say, but what I mean by that is basically that it was childcare operators who were not running the Toronto early childcare services, so not the city-run. So 87% were not city-run childcare operators. Single site versus multiple site operators, so nearly 1/3 operated or worked in multiple childcare sites. And nearly 1/3 operated for-profit centers or agencies. Approximately half ran or worked in at least one site located on the school property. Majority served early years and before and after school programs, and the majority received funds from the city at 78%. Okay, so what did we hear? So overall, I would say that the number one thing that we heard was really that from all the findings, from all the comments that were shared, they really spoke to the opportunities for operators to engage and voice their opinions. That was the largest thing that came through. And what was really interesting is we were asking specifically about the DCCA meetings, but the comments that came through were not specific to just the DCCA meetings. They were really talking generally as well about this opportunity to engage and voice opinions. So that was a really significant thing to look at, and really was kind of a message for, I think, all of us that are involved in, planning and working together, that we really want to be mindful all the time on both ways, to constantly think about how we can strengthen and continue to provide those opportunities. For these particular findings and for these particular recommendations, we're focusing just on the DCCA meetings. because that's what we wanted to keep it focused. But we also want to be mindful that the DCCA meetings are only one part of many different opportunities, knowing that you all work closely with your consultants, that there's supervisor networks, and that there's other opportunities as well. So keeping in mind that this is just one part of many different opportunities that occur. Okay, so overall, the large majority of operators who attended the meetings do value the DCCAs and are fairly satisfied with the meetings. So 75% of the operators were mostly satisfied. Additional 15% were very satisfied. 93% of the operators consider the meetings to provide value. That's not to say that there's not great areas for improvement, as you'll see when we get into the findings further. But what that really tells us is that the DCCA meetings are important, and that people want them to occur. So we want to get together in some way to be able to have access to various information and to have these opportunities to engage and inform the important things that are happening. Based on the comments shared, the strengths were that there was again, strong value placed on the meetings. There was high satisfaction with information shared from the city. So what came forward was that people were happy that there was information, that the city was coming, and there was information that was being shared. You'll see in the areas for improvement, there was other areas that we could continue to improve. But generally, there was also relative satisfaction with the answers that were provided. Areas for improvement, again, this will be a constant theme. It was very clearly stated that there's insufficient opportunities for operators to feel engaged, and that really came forward with the opportunities to ask questions, the opportunities to provide feedback and provide input, and we'll talk a little bit more about some of the reasons that came through around that. Some people talked about how they were unsure about the influence of input or what actually happens after the input or the questions that are being received. So that was a really important takeaway that you'll see come through in the recommendations. That operators have limited say into what is discussed at the meetings. So a real request for having further input into the types of topics that are happening at meetings was very clear. And also minutes from the meetings need improvement. So being able to document not only kind of what's discussed, but some key actions and some follow-up items as well. That really came through. We also asked about the level of comfort. So how comfortable do people actually feel at the meetings? And what was interesting is that generally people said that they felt comfortable attending the meetings, so being here. But then when it comes to asking questions, sharing your opinions or ideas, or raising issues, you can see the comfort level went down. And so if you click the next one, so it's really those three in particular that people mentioned. So nearly 3 out of 4 operators reported feeling some type of discomfort in each of those areas. So in the comment section, we asked a little bit about what that might, about some of the reasons for that, and there were several different themes that came up. One is the setup and the degree of formality in the meetings that really impacting how people feel. Some people talked about personal preferences, that it's just not for them. They're not comfortable sharing their opinions and asking questions in large group settings. Some people talked about how the airspace is not always shared between participants. And when there's limited time, this can make this even more challenging. That it doesn't always feel inclusive for all operators. So that really talked to some of the for-profit operators talked about not always feeling as included in the meetings or in the topics, and the same with some of the operators who don't have subsidy contracts with the city. So that was a really important thing too, that some people aren't feeling as included as others. The potential for the tense environment. So I think it's important to note that parties on all sides recognize that sometimes there can be tension at the meetings, and that was something that was really impacting how others were feeling about participating, about providing their input, about asking questions. So that was a really important thing to note. And also the power dynamics. So I can say for myself as being a city staff as well, I think the city plays multiple different roles. And one of those roles happens to be a funder. And so a number of operators spoke about the nature of that role. And so feeling comfortable or how comfortable they felt asking questions or raising issues to someone who is essentially then funding their program. And so that was also something that came through from a number of operators that we also wanted to take away and think about, because that role is what it is, but how do we then help people feel comfortable in still being able to provide their input, provide their feedback? So that was something that we definitely all talked about in our meetings over the summer as well. Okay, so preferences. So what do we really want out of the DCCA findings? You can see there were some absolute clear winners. And this is from both child care providers, the Children's Services, the province, the school board. Others definitely responded saying that they wanted the meetings to include updates from the city, updates from the province, and they wanted operators to provide feedback and to be able to raise issues. A large number also said that they wanted to hear updates from the school board. I would assume that would probably be from operators who are operating in the school boards as well. But certainly those were the things that absolutely were really important to future DCCA meetings. For those of you who completed, you'll remember that we asked what should be included in the DCCA meetings, but then we also asked whether it's something that you feel is important, but maybe not for the DCCA meetings. And so you'll see a couple of those other topics came out under that second category. Things like learning from other centers, general child care topics, and discussing issues and best practices. So you'll see those people felt were important, but maybe not something that needs to happen at the DCCA meeting. Maybe we could look at those in some other forum as well. Okay, so the key takeaways from the finding from the survey. Overall, it was interesting. Supervisors seemed more satisfied with the DCCA members' meetings than owners, directors, and board members. Wasn't able to really pull out exactly what the reasons for that are. I don't know if it has to do with supervisors having more contact with the consultants. Some of them spoke more about the supervisors network as well as being an important contact. But that was an interesting finding. Operators with various roles and interests are attending the DCCAs. So that's really, supervisors versus owners, city-funded versus non-city funded, private versus nonprofit. So it's really important that in the DCCAs we're remembering all of those different types of participants that are attending and making sure that the meetings are of interest to everyone as well and that everyone's feeling included. The same person is often attending both the DCCA and the supervisors network, so we want to make sure that those are not overlapping, but that the content of both are complementary to each other. Attendees from all groups sometimes experience tension at meetings. So we talked about that a few slides ago, and so we talked again about that over the summer, and we really want to, through our recommendations, have talked about how to make it a positive space where people can feel comfortable participating and having a good partnership. DCCA participants value the meetings and the information shared, but many do not feel like partners at the DCCA and do not feel that their inputs are valued or influential. And I want to emphasize that some of this came through, and this is perceptions. I can say as a city staff, I've been part of many meetings where absolutely it's the opinions are valued, but perception is a very important thing. And so what's really important is that people feel and understand that their opinions are valued and know what happens when they're providing that input. So that's certainly something that we talked about over the summer as well, of how do we make sure that that loop gets closed when there's information and input being provided, and how do we make sure that people understand that that input actually absolutely is valued and is utilized. That we need more opportunities for participants to provide input and feedback, including alternative private options for those who don't feel comfortable doing so in an open forum. So we talked about that. And then finally, the last two. That the logistics of the meetings need to be strengthened. So those are things like the minutes, the setup, looking at the roles, And then also, when we asked about the preferences for location and frequency, there really was no single preferred approach. It was kind of all over the map. So we talked about that as well, and you'll see that we have suggestions or options included in the recommendations today. So that's a quick kind of run through. As I said, we'll have more of the findings that will be available online, but just wanted to provide an opportunity whether there's any questions or comments for clarification before I pass it over to my other group members to share with us some of the recommendations. Yeah, Jennifer. Any questions or comments? Yes. Mhm. So a quick comment, then I'll pass it over. And to summarize, I think the comment from Jane, or comment in question, was again pointing out the power dynamics and the reality that the city is a funder, but holds multiple different roles, is involved with the AQI, and is involved in doing consultations, and is also the funder. And whether or not, as a strategy group, we had come up with a bright idea, as you say, to be able to balance those, or how to work through some of those multiple various different roles. I think I'll start by also just saying certain things like the AQI and that role wasn't something that we were necessarily talking about. That doesn't mean it's not something that we can take away and discuss. I think there is a reality, absolutely, that the city holds multiple different roles, and there's certain components that come along with holding multiple different roles. It's a challenging situation, and it's not an easy fix when, you know, we have those multiple different requirements as the service system manager to ensure quality, but to also fund and then to provide the support. So it's absolutely a tricky type of balance. And so that wasn't necessarily something that we got into, because that's a very large question, but I think it's something that we can always continue to discuss and try and continue to find the right balance. But I'll pass it over to give some input on what we did talk about this summer.
I think if I can just say that it's not something I think we tackled in that group, and as Suzanne is saying, that's not to say it can't go back and be a conversation at the group. I think the challenge is, Jane, that all of the people who were on the strategic group are all very outspoken. So there was never a time at that table where we weren't sharing with the city the things we were feeling that were maybe, you know, we needed to consider, or making people uncomfortable, or the fact that the city plays these multiple roles. But the group of us that were in the room were not holding back, I wouldn't say in any way, in making those kind of comments. So that might be why it didn't come up as big an issue as you are maybe hearing from the community, Jane. And we recognize that that may be the way many community members are feeling. But for those of us in the room on the several times we met, that wasn't a concern.
Okay, so I'll just pass it over to Dina. She's going to give a quick introduction to how we're going to look at the recommendations, and then our colleagues will share with you what those recommendations are. Is this one working? We'll do something. Okay. Excuse me. I'm pretty loud, so we can try this.
Karen, do you mind starting to pass out the clickers?
So we want to just review where we're at right now. Oh, I just knocked the. Sorry. Okay. Is that one? Was it on?
Remember setup in space? Things that came up in service.
Okay. Sorry, I just knocked off the PowerPoint cord because it's hanging on by literally a thread here. But what I'm going to do really quickly before we hand it over to the rest of our teammates is talk about just a quick overview. So where we're at, as Suzanne already mentioned, this started back in March 2015 with a conversation at the DCCA. Then we did the survey in April, and we came back to you guys in May just to touch on it and seek for input for our strategic team. And like we said, the chairs, the co-chairs, the community co-chairs, and self-selected volunteers came with our strategic team, and it was a robust team. We're here to present to you today. And get some feedback on the recommendations, and ideally we're going to come back in November with some next steps and feedback on what you give us today. When we came back and we sat together as a group, we really had a breakdown to think about what our conversation was. We had a lot of rich data with the survey results, but we really focused on two areas. The first area is, what are we trying to do with DCCA meetings? What do we want to achieve? And because as we found with the surveys and recognizing all the other venues that you have, sometimes we're trying to achieve so much and we're not doing we don't have the time to really achieve what we need to. So focusing on the purpose of what this meeting is, what the DCCA meeting is, and then that helps us also think about who really needs to attend and who our audience is. And once we know what we're trying to achieve and who is going to attend, we need to make the meetings work to achieve that purpose. And so that's why we started thinking about different things like developing principles, and then thinking about who should be part of a planning group to set the agenda, and how should we facilitate. I mean, we all talk about this space here. We're in the Etobicoke Civic Center in the council chambers, where it's really disconnected from the presenters and the audience. So, you know, how do we find, how do we have meeting spaces that really facilitate our communication? And then how often should we meet and where should we meet? Recognizing the challenges of everybody attending meetings, but recognizing, especially from the survey results, who we want to be at the meetings and what kind of information we want to share. So based on the survey results, we are going to consider a few of the following types of recommendations. We want to talk about how we maintain information sharing for children's services. That's 94%. But we also want to strengthen the opportunities for the province and the school boards to attend regularly and regularly share their information. We want to increase opportunities for participants to give their feedback and raise important issues, and create that follow-up loop about the feedback and the important issues. We want to create a positive space that really fosters our relationship. And as Dorina said, you know, we're all here supporting each other to create quality childcare. And we want this space to mimic that, to be part of creating positive space and quality childcare. We want to improve the tracking and following up of the action items and the issues that are raised, and we've heard that loud and clear that sometimes an issue is raised, but we don't have a meeting for a while and we have to focus on the next action item because there's been so much change over time. And we want to complement the supervisors network and not duplicate it. And that's where a lot of kind of the nice to haves of networking and capacity building are nice spin-offs of the DCCA, but people clearly told us that doesn't need to be the focus of the DCCA. That's the focus of the supervisors network, and let's focus on what the real purpose of the DCCA is.
Okay. Sorry, there might be a technical issue. I'm going to have to shut this down and relaunch with, I think, Turning Point shut off. Okay. I have one question, the test question. We're just re-pulling up the PowerPoint to open the test question and use the clicker. So this is our test question with our clickers. What is your favorite primary color? Please use your clicker and see if it turns green, then we know that we're getting lots of responses. So I'm going to close it in 5, 4, 3, 2, 1. So we see 35 responses, so we'll try to get to 35 every time we have a question to know that everyone answered it. Poll is closed. All right, blue is our clear winner. Let's see if all of our recommendations follow like that. And now I'll hand it over to my colleague, Janet.
Thank you. Good morning, everyone. We're now going to go through the recommendations that are coming out of the District Child Care Advisory Strategy Group. And as I say, the group met over the summer and spent quite a few meetings coming up with these recommendations. And if you look back at the slide that Dina presented, which talked about the things that we wanted to make sure came out of the questions today. So looking at things like the purpose, the principles, the facilitation of the meetings, the planning of the meetings, those are the things that the questions are going to go through. So the first recommendation is for the purpose, and there are 3 purposes that the group is putting forward, and these 3, because the group felt they were important, are going to be voted on separately. Some of the other questions are sort of going to be in a grouping, but this question is going to go separately. So the 3 purposes are seen as the child care sector can hear information directly from the city, the province, and the school boards on issues and initiatives that affect the child care system. The second one is children's services and other decision-making planning bodies can seek input and feedback from the child care sector on initiatives that affect child care. And the third one is the child care sector can raise issues, ask questions, and promote dialogue on the child care system. So coming out of the survey and the meeting of the group, these are the 3 purposes that were developed. And so now we're going to move on to voting on each one of those separately. So the first one you're voting on is the child care sector can hear information directly from the city, the province, and the school boards on issues and initiatives that affect the child care system. So you're going to be voting using your clicker. A, strongly agree, B, agree, C, neutral, D, disagree, and E, strongly disagree. So if everybody can take a minute or so and push their button, then we will calculate the totals. Very good. So we have a very high percentage that agree and strongly agree to that purpose. So that will be information that will go back to the group. That's great. The second piece of the purpose was children's services and other decision-making and planning bodies can seek input and feedback from the child care sector on initiatives that affect child care. So voting will take place in exactly the same way, but on that particular statement. And again, there is a very high indication of strongly agree and agree. So that's great. That information will go back. And then the third part of the purpose is the child care sector can raise issues, ask questions, and promote dialogue on the child care system. So using the same A to E, if people could vote. Results are coming out fairly similar on all three parts, so that's great. Recommendation 2 is looking at a vision statement. Establish a vision statement for the district child care advisory meetings. The vision statement should reflect the DCCA meetings as a collaborative meeting place to share information, place for constructive dialogue, and a place that supports a quality child care system. So again, we're asking people to vote. This particular vision question is being done all together. So you're voting on all 4 at one time. Collaborative meeting space, place to share information, place for constructive dialogue, and a place that supports a quality child care system. And you're picking A to E.
Sorry, just to let people know again who are viewing this via WebEx, there is not an opportunity to vote on this at this time. It's just for participants who are at the meetings. These questions will be at all 4 meetings. If you do want to participate and send us feedback, you can always email us at childcare@toronto.ca. Thanks.
It's going to take a little bit to get used to. There's other people on the other side of the room. That's a really high number for strong voting. Gives us some good information to go back and work with. The next question has to do with principles, established principles that will guide the DCCA meetings. And again, we're looking at 4 different principles. We are partners working for a quality child care system. We value collaborative engagement. We value each other's professional and experience, and we understand that we are a complex system with many different valuable contributors. How true that is. So we just wanted to provide a little bit of information around each one of those. So partners working for a quality child care system, strengthening Toronto's child care system, maintaining and improving a quality of child care in Toronto, and increasing access to quality child care for all families. So those are sort of the indicators under that one. We value collaborative engagement, acknowledging that responding to the changes in the system has been a shared experience by all participants. So the amount of change we're going through right now, we need to ensure that everyone is understanding and receiving the information they need. And that has caused some stress and uncertainty for us all, and that's probably very true over the last few months when we've been experiencing some massive change. Recognition that different views and approaches can lead to a constructive dialogue for which we can create better outcomes. The next one, which was we value each other's professionalism and experience. Importance of all parties working together as partners in an ongoing way during times of transformation and during times of stability. Importance of input and feedback from the child care sector, and of all sharing results and impact of consultations. So we've done a number of consultations, the survey being an example of one most recently, and so wanting to ensure that the community gets that information back and as part of the process moving forward. We understand that we are a complex system with many different valuable contributors. The importance of each contributor in the childcare sector and diversity of the sector makes it challenging to meet all needs and preferences. And we've certainly discussed that at previous DCCA meetings. So we're going to vote on those principles right now, and they will be voted all together. So just to remind people we are partners working for a quality childcare system. We value collaborative engagement. We value each other's professionalism and experience. And we understand that we are a complex system with many different valuable contributors. And so again, you're voting from A to E. Extremely high. So each one of these questions is giving us more information to go back and consult about. So it's very important information. Recommendation 4 is to create new opportunities for DCCA participants to raise issues that are important to them. And this is addressing the one that came out in the survey that talked a little bit about people feeling that they actually had input at the meeting or were comfortable having input at the meeting. So we're proposing to provide a variety of different ways for participants to raise issues for discussion at DCCA. These could include online submission forms, a physical suggestion box at meetings, and dedicated times in the meetings or other ways. So again, we're still open to looking at other ways that may be means in which we can give people that opportunity, but these were some of the examples that we came up with in the group. And certainly the online submission may be a way that we can find a way for some of the people who are streaming the meetings to be able to participate. So again, that question is, provide a variety of ways for participants to raise issues for discussion at DCCA. These could include online submission form, a physical suggestion box at meetings, dedicated times in the meetings, or other ways. So if people could vote on that question. Again, very high numbers in these strongly agree and agree. So this is a great way of sort of telling the group that we're on the right track. There's more work to be done, and we know that, but at least we can see from the information coming out so far today we're moving in the right direction. I've got one more recommendation, and then I'm going to turn it over to Janet. So recommendation 5 is to improve the mechanism for documenting and follow up on issues raised and key questions asked. And the proposed recommendation is to develop a transparent process for documenting, reviewing, and responding to key questions and issues raised, to revise the format for minutes to capture items that require actions and follow-up. And I know with the survey that the minutes were something that people were commenting they'd like to see changes to, so this is the one that's sort of addressing that. So the vote is on developing a transparent process for documenting, reviewing, and responding to key questions and issues raised, to revise the format of the minutes to capture items that require action and follow-up. Okay.
I like this clicker thing. I'm going to use it at home at the dinner table. I'll be the only one with the clicker, though. So interestingly, my questions are, the first one is around time, and we're short on time, so I'm going to move a little bit quicker, I think. The written comments on the survey often expressed that there was not enough time at the meetings to address the issues important to the sector, and it also indicated that operators felt they had very little opportunity to inform what was on the agenda. So this recommendation, number 6, is to create a way for all parties to work together to develop DCCA agendas, ensuring that the agenda items respond to the current issues, initiatives, and opportunities that are important to the childcare sector. So we proposed that we develop an agenda planning team that will meet before the DCCA meetings to review the issues raised, discuss potential agenda items, and set the agenda. So we're proposing develop an agenda planning team that meets before the DCCA meeting. We will review the issues raised, discuss potential agenda items, and set the agenda. And your voting is that you strongly agree, agree, neutral, disagree, or strongly disagree. All right. Recommendation number 7, revise the location and frequency of the meetings to allow more time and help more parties to attend. We have proposed stream the meetings online so people can watch and listen remotely if needed. So this would be whether a person, this is talking about whether or not the person has the ability to streamline. So do you have access to a computer? Is there time in your day either to see it live or at the end of your day to review it? And is this a realistic option? So would you be able to watch and listen to meetings online either live or afterwards if it was available this way? Number 8, revise the location and frequency of the meetings to allow more time and help more partners attend. Participants were clear that having the province and school boards attend more regularly was very important. So the recommendation, keeping this in mind, there are 2 options that are proposed. Larger meetings in one location, and no district meetings, so a larger meeting of all 4 quadrants. So this would be, the considerations would be that there would more likely be opportunity for other partners to attend. Having a single location may not be convenient for everyone. Higher number of people attending, so there would be less opportunity for questions and more opportunity for networking. And number 2, the current model of district-based meetings have 5 meetings a year in 4 different locations. And the considerations, less likely that partners could attend. The locations are more convenient. The operators can connect with their district directors, and a fewer number of people attending. So there might be greater ability to ask your questions, but less people to network with. So how are we voting? Okay. So which approach would you prefer? Option number 1, meet together in one meeting, or option number 2, meet in 4 district meetings. And the one meeting would be live streamed. Go ahead.
With the quadrant meetings, that you likely will not have the school boards in the province participating in all those meetings. They've made it pretty clear they can't do 4 meetings in a week. So that is part of the consideration we want to make sure people understand when you're voting.
All right, recommendation number 9, revise the current roles of chairs and co-chairs. So it's proposed that we develop a new meeting facilitator role. The facilitator's role would be to keep the meeting focused on the agenda and on the purpose, vision, and principle of the DCCA. So I think this approach will help meeting achieve the vision and principle of the DCCA and be valuable for all participants. Strongly agree, agree, neutral, disagree, and strongly disagree.
There are just 2 questions left, so we'll go through those really quickly, and these are sort of a little bit more generic questions, and that's why they're outside the rest of the questions. These recommendations support my vision and expectation for the DCCAs. So we're now asking you if the total recommendations would support your vision and your expectation going forward. And the last question is, based on the feedback we shared today on the recommendations, I support the DCCA strategic team to finalize the terms of reference, meeting format, and report back to the November meeting. So your options are a little different there. Yes, no, and I don't know. That's great. Okay.
All right, so in 10 seconds that we have left, thank you everyone. Really appreciate providing, first of all, the feedback and the comments through the survey, which there was a tremendous amount, so appreciate that. As we said, the strategy group will take this away and we'll continue to meet, finalize the terms of reference, and we'll bring that back to everyone in November, with the intent being that we have a new format that we can begin at the beginning of 2017. Okay, and if there's any further comments, please feel free to email those to childcare@toronto.ca.
So just in closing, two microphones here, sorry. So just in closing, we reached out and we were able to confirm that there's been 300 infants that have been allocated fee subsidy and are looking for placement. So that was just in relation to the question earlier. I just want to thank everyone for coming, and I encourage you to touch base with your colleagues and your consultants after the meeting. And I want to thank you for being so patient. This was our first test at streaming. There were some technical difficulties, so we'll make sure for the next one we actually have things in place. The next DCCA is Monday, November 21st, so you will be hearing back on the results of the format. And then I will remind everyone to check online for the upcoming budget overview sessions. The first one is September 27th, that's tomorrow, 9:30 to 11:30. Our West session for the budget overview is going to be Tuesday, October 11th, and it's here at Etobicoke Civic Center, and it's 1:30 to 3:30. So I really encourage you to come to those sessions. You will hear new updates from the funding model team, okay? And that's it. Thank you, everyone.
Thank you to everyone who joined us on WebEx. The session is just about to be closed. I do want to feel free to provide us with feedback at childcare@toronto.ca. In the future, we will look for opportunities to make it more opportunity to engage on the online session. But for now, we'd love to hear your comments about the streaming experience. Thank you very much.